Live.
Thank you. Okay. I'd like to welcome everybody to this meeting. My apologies of the Corporate Overview and Scrutiny Committee. My apologies for the late start, which has been due to technical problems, which I now think that we're over. We'll go away. I haven't got the agenda in front of me actually, because I've got some other things. The first item is apologies. Do we have any apologies?
Councillor Rob Bird, and we've got Councillor Brian Tipper substituting.
Thank you very much. And then presumably it's the minutes of the previous meeting.
Yes, the minutes of the previous meeting.
Is everybody happy that it's a long time ago, the previous meeting? Is everybody happy that they're a true and fair record? Anybody against? Good.
I think we can take that as accepted. Chair.
Next item is
declarations of interest.
Any declarations of interest which anybody wishes to make pertinent to the agenda in particular? No? Good. Then we go on to the first item, don't we?
Well, we've got the work plan. So that's just an information item with the forthcoming executive decision list. It's also a link to the council strategy. Okay.
I've just lost everything on my program here. Lost. Sorry, you're going to have to read it out. I've lost the whole of my program on my other computer.
So for that item, what we've got a link to the, as I said, the forthcoming executive decision list, so that members have got sight of that, what the cabinet are due to make decisions on. A link to the council strategy. So those is largely for information, unless members wish to raise any issues. It's probably worth saying at this point, if members wish to speak, the easy way to do it is simply to put your hand up. You can see on the screen in front of you. If you tap it, or if you're on a laptop, you tap the keyboard. If you tap the participants, which is the button with the person on it, then if you're on an iPad, you can raise your hand at the bottom. You'll see it says raise your hand. Once you've spoken, lower your hand. If you're on a laptop, then you can raise your hand against your name, but lower it afterwards. So I can't see anyone at this stage indicating they wish to speak, Chair.
Simon, I'm indicating.
Kate.
Yes. Can you see that?
Yeah, so am I, Simon.
Yeah, I'm seeing, and Brian has just come up. Yeah.
Okay. It's just a question in regard to decision making. Are we now, obviously during the first part of the COVID crisis, there was a lot of delegated decision making. So are we now at a point where decision making has gone back to our normal practice, or are there still some decisions which are delegated under emergency powers?
I can answer that, Kate. In actual fact, in the end, there were very few decisions that were taken under delegation. I can't say for absolute certainty that we won't have to take some more urgent decisions. For example, I know there's one that may be needed within the next couple of weeks around a grant that's just been made available to us for emergency relief for people who are struggling to afford food and essential supplies. We'll need to make a quick decision about what we put in place to meet that need so that we can begin to distribute that. But where we are having to make urgent decisions, first of all, the conditions for that need, the conditions that the Constitution sets out need to be satisfied, and amongst those is that we consult with the chair and vice chair of the relevant scrutiny committee. So I can assure you that if we do need to take any emergency decisions, we'll be going through that proper process. But actually, in practice, it's proved that we haven't needed very many. So the vast majority of decisions are being taken in the usual way that they would at the moment.
Okay, thank you.
I think it's fair to report that the decision was taken this week because the due notice appeared going out, which I agreed to, that we didn't have to give the 28 days notice because we had to fulfill a government return. Okay.
So, Chair, we've got Councillor Brian Robinson and then Councillor Leslie Williams.
Brian.
Yeah, my thoughts.
Brian?
Yes, thank you. My thoughts on the work plan were that we needed to build in somewhere to look at the financial impacts of the changes that have been brought on us through the COVID-19 process. I see that the finance monitoring report we're looking at today is the end of the financial year, which largely was outside of the recent events. So whilst that's obviously something we need to be doing, I think quite urgently as a committee we need to actually understand the major other forces that have sort of wreaked havoc on councils and what that means for Gloucestershire. So I think in a work plan we need our next meeting to be having a major item on that. Thanks.
Actually, Brian, there was an additional agenda item which was on this current year and what it looked like at the moment. I don't know if you've seen that, have you?
Well, I'm looking at the agenda we've got in front of us. I can't see where that's been picked up. So I'm happy if it is, but I can't see from the agenda I've got in front of me where that is.
Simon, I trust everybody got that additional paper. I certainly got it.
Chair, I'll clarify just to say there is a supplementary report pack which includes the latest financial update which went to Cabinet. So that is part of your papers if you're looking on modern.gov, but it will be over an additional
I see
PDF.
It now. It's in a separate document. That's okay. Thanks. I couldn't see it on the agenda, but it's a separate item.
It was as Stephen said, it was the carrot paper. I'm just trying to see it on my system now as well.
Okay, can I ask my question, please? Which is...
Hang on, if we can just get this sorted out, Leslie. I want to make certain that the public are aware of it.
Thank you.
Are you going to discuss that as items?
It's an additional paper on the modern gov.
Right. So under the finance monitoring report, we're going to take the additional paper as well. I understand it now. Thank you.
Correct.
And then we've got Councillor Leslie Williams.
Permission to speak.
Yes, of course,
Thank
Leslie.
you. I just wondered, now the council has the legal powers for dealing with local outbreaks, is that something that this particular scrutiny committee should be aware of? I suspect that if the need to decide to do something does come, it will be speedy. But I just thought it might be a good idea to let this. Is it a good idea to let this particular scrutiny committee just know what the process is?
Rob, are you able to answer that?
Pardon?
No, I was asking Rob if he was able to answer it.
I can in outline terms. So the decision.
Thanks, Rob.
The decision would be taken either by the Chief Executive or by the Director of Public Health. That's in line with the national guidance. There are certain requirements that we would have to meet if we were doing that. Some of those are to do with who we need to consult with, which is largely our partners in the health service and police. But there are also conditions that we need to meet in order to impose one of those restrictions, and those are fairly tightly defined, amongst which is that the need to do so has to be urgent. So we would also need to satisfy ourselves that those conditions were met. In terms of the process for making that decision, we're working on a template at the moment that we would use so that it's very clear what our assessment of those conditions is and how either Pete Bungard or Sarah Scott has reached the decision that they have done. The other requirement is that we do publicise the fact that decision's been taken, not least of all for the premises or area that's affected. But I see no problem with letting members know more generally that such a decision's been taken, and I would expect you to want to know given the seriousness of it. So whether it's to this committee or not, I'm not sure, but we can certainly undertake to make sure that members are aware if we're having to take one of those decisions. Also worth mentioning at this juncture, of course, though, that the numbers of cases currently in Gloucestershire are extremely low, and so we're not anticipating having to take such a decision at present.
Thank you very much. Are there any more questions?
Just ask Leslie to lower her hand, if that's all right.
Can we move on to the next agenda item, please?
The next agenda item is Rob's strategic performance update.
If you'll just bear with me a moment, I'll attempt to share my screen with you. So I've sent a couple of papers out this time. You will appreciate that at the end of March, when we would normally be compiling the end of year performance information, we were rather distracted with other things, not least of all responding to the emergency and making sure we were capturing the data that we needed to support our response to that emergency. And therefore, apologies, there are one or two gaps in the detailed performance annex that you'll have received. But I've accompanied it with a written report to take you through the headlines as they were at the end of March, to give you a picture of the council's performance at the end of the year. But bearing in mind that information is now slightly out of date, several months have passed since, I also thought it would be useful and helpful if I gave you an update on some of the ways that the COVID emergency has been affecting council performance. And so that's the presentation slides that I've put in your pack. My intention is just to take you through those and talk to you about those for a few moments. I'm hoping
we can see them, Rob.
Those. That's great, thank you.
Yeah, they're on the screen now.
So I'll just talk you through the headlines of those. When I finish doing that, I'm very happy to take questions either on these slides or on the year-end performance information that you've received within your packs. So let me begin. So the first thing that I've looked at is what the impact has been on referrals and contacts coming into both children's social care and adult social care. The line across the middle of this graph represents the normal amount of referrals we would expect to get for this period, and the blue line is the actual number of referrals. And you can see immediately that from the beginning of the lockdown period, there was a real drop-off in the number of referrals coming into children's social care, 40% fewer in the middle of April than we would normally expect. But by the 7th of June, that returned to more like the level we would expect to see, and has continued at that level up until the end of June, which is where the data for this graph stops. First of all, referrals are back to the kind of level we would expect, but it is reasonable to assume that there is a backlog, and with schools not having been fully operational for this period, that there is probably some demand out there and some need out there that has yet to surface. Schools, as you'll know, are one of our biggest referrers into children's social care, and so the fact that those schools haven't been in regular contact with a number of these children will have affected that picture of demand, and we can expect to see that demand appear at a later stage in the year, probably around about September when schools come back. Of course, that will be an issue that's unique to us. It'll affect other areas of the country as well. And we are starting to plan for that and to model what that might mean for demand to children's social care so that we can anticipate what we need to do. Moving on from that, sorry, I've clicked through a couple of slides at once there. Got a slight delay, which isn't helping me. But what we have been doing...
Sorry.
Can we wait for questions until the end, I think, please?
You're doing questions at the end. Okay, it was just a really quick clarification on that.
Questions at the end. So please, can we wait until questions at the end? Rob, would you like to continue, please?
Yeah, thanks, Sean. I appreciate that. It's just there's a slight delay on my line while I'm doing the presentation. So if we don't do it this way, we'll end up talking over one another. So this graph looks at how we've been making sure that those vulnerable children who we are working with, that their needs continue to be met during the lockdown period. So what this shows is the numbers of children in need, of children subject to a child protection plan, and of children in care whose needs have been reviewed during the lockdown period. And you'll see again that at the beginning of lockdown, in the cases of children in need and children in care, we'd only reviewed about 58% of them, but as we've gone through that lockdown period, we've got to the point where very nearly 100% of children have had their needs reviewed, and we've made sure that they've got appropriate support in place. And we compare very well with other areas. We've had some early benchmarking information on this, and our performance has been good at making sure we stay in touch with those children and what they need in terms of support. Moving on from that, I've already referred to the fact that that schools obviously haven't been running at full capacity, but you'll be aware that one of the priority groups for schools to provide for was vulnerable children. And by the end of June, around about 28% of vulnerable children were attending school on a regular basis. Now, clearly, that's far from 100%. But the nature of some of these children's circumstances is that they're likely to be amongst those that perhaps are more reluctant to go to school. And again, when you compare our performance with other areas, we are within the pack on this particular indicator. So it's not seen as a cause for concern in as much as we're not an outlier, though obviously, given what I've said previously about referrals into children's social care, we are very aware that that we may not be getting some of those referrals through as a result of children not having been in touch with their schools for a while. Just moving now into adult social care, and you'll see that these two graphs, first of all, look at contacts into the adult social care help desk, and the one on the right at actual referrals. So that's when an initial assessment has been carried out, and that contact is then referred into adult social care for more formal help and assessment. So what you can see is, again, a similar pattern, though not as deep a difference, but that at the beginning of lockdown, contacts and referrals both dropped to lower levels than we'd experienced previously. In the case of contacts, round about the beginning of June, those started to return to normal levels, and as the system catches up, they've exceeded normal levels for the month of June. But in the case of referrals through to adult social care, those have remained below the level that we would expect to see for this point in the year. So even though the number of contacts has been going up, a smaller proportion of those have been translating into referrals into the system. Of course, one of the major emphases of the last couple of months has been supporting discharges from hospital. And you can see there the numbers of discharges that we've supported and how that pattern has changed. So right at the very beginning of lockdown, we were supporting a very high number as we worked to get people out of hospital as swiftly as possible. That then dropped during April and May, and then started to increase again during June. We don't yet have benchmarking data on the rate of delayed discharges from hospital, so I can't yet tell you what that will mean, but that will come through in the Q1 data. The other thing that I know there's been a lot of concern about is domestic abuse, as people are more confined to their homes. This looks at the average the number of referrals into the domestic abuse helpline during the period of lockdown. Now, it's not shown on the graph, but it's there in text at the top that the pre-lockdown average was 95 referrals a week. And you can see that for the first half of the lockdown period, on average, that was round about the number that we were getting a week. Some weeks were higher than others, but that subsequent to that, the second half of lockdown, there was an increase in the number of referrals into the helpline, but that had begun to return to normal levels towards the end of June. No fancy graph on this one because we only got very limited data, I'm afraid, but this also looks at the mental health picture. So we set up some additional mental health support in the form of helplines during the lockdown period. Quell, I think, is for all ages. Couth is for young people specifically. And from the end of May to the end of June, you can see that there were a healthy number of logins to both those services. As we go forward, we'll be able to provide some more trend data on those, but at the moment, that's all I've got, I'm afraid. This next graph looks at support for people who are extremely vulnerable to COVID-19, so what's become known as the shielding cohort, colloquially. I give you some numbers for Gloucestershire. So 25,000 people in Gloucestershire were advised by their GPs to shield because they had a medical condition that made them extremely vulnerable. Those people were then encouraged to register on a national government website for support should they need it. And of those 25,000, we had 15,000 registrations locally. We were, of course, concerned that not everybody would have web access and not everybody would necessarily understand the process for registering for support. And therefore, we went to a lot of effort to make contact with everybody on that shielded list. And by the end of June, we'd actually made outgoing contact with 12,000 of those people. We focused obviously on those who hadn't registered. So by the end of May, actually, we'd pretty much made contact with, if not everybody, nearly everybody who was shielding to make sure that they were aware of the support that was available to them and how to request that. At the end of June, which is when this data applies again, there were 2,400 odd people in Gloucestershire who were receiving government food parcels. Those are the weekly parcels that are sent out centrally on a once-a-week basis. That number has now reduced down to 1,900. And as you're probably aware, that service comes to an end at the end of July. And so district councils and central government are now making contact with those 2,000 people to make sure that they understand that service is ending and to discuss with them what arrangements they can put in place to ensure they carry on getting food should they need special arrangements to be made once that ends at the end of July. The final figure, the 708, one of the things that people could register when they went onto the national government website was that they needed additional support for meeting their basic needs. So that would be things like help with getting the bins in, help with washing, the sorts of things as well that we'd normally use adult social care to provide for. And each one of those resulted in a referral through to us locally, which we then either passed on to adult social care or to district councils to meet, depending on the nature of those needs. And I think one of the real success stories of the past couple of months has been the strength of the local response to people both requesting help through this process, but also through the Community Help Hub. Certainly the feedback we're getting from individuals and from district councils and from the voluntary sector is that there has really been a tremendous response from local communities and statutory agencies to the extra support that people have needed. And I think when the dust has started to settle and we've time to reflect on this, I'm quite sure that one of the success stories of the last couple of months will have been the way that communities and organisations have rallied round together to meet the needs of people, both with shielding or who have additional needs as a result of the crisis. And I know some of you as members have been right at the very heart of that response. In terms of the kind of requests that we've had coming into that Help Hub, this pie chart breaks those down. So the vast majority have been about either collecting prescriptions, that's this orange triangle, or what we've described here as food cover, people needing help getting food and essential supplies. Those have been the main areas of requests for help. There has been some requests for social contact and things like putting bins out. Those were mainly at the very outset of the process. And as the weeks have gone by, it has leaned much more towards food and prescriptions. But again, all of those help requests have been sent through to district councils, have been matched with offers of support, and have been responded to. You'll see in terms of the numbers that the number of inbound requests peaked at the beginning of April, but then fell off quite rapidly and until the end of June. And over the weeks since then, we really are only seeing a handful of new requests coming in and are able to respond to those very quickly. It's also worth mentioning at this juncture that there are a small number of people that are getting ongoing support from district councils. Those are in single figures or tens in each of the districts. On the whole, Cheltenham, they're slightly higher, but are also coming down. And the districts are working really proactively now to make sure that that there's a permanent solution in place for those people, that they are getting the help that they need on an ongoing basis. Moving away from the Help Hub and into wider issues, these two graphs look at the impact of the lockdown on traffic volumes across the council. So this graph on the left looks at all vehicular traffic. It takes data from a number of the more significant roads in the county, and you can see that again at the beginning of April, a very dramatic drop in traffic volumes as lockdown takes effect, and then a gradual return to more normal levels. And although I took this graph at the end of June, we're now a couple of weeks on from that, and as of yesterday's data, the figure was up to 85%, so very near normal levels. Conversely, we've seen an increase in the number of people cycling. That peaked in a very hot week that coincided with what would have been half-term break at the end of May. I'm guessing that that's largely as a result of people having pre-booked time off and using it to cycle in the good weather. More typically, it's been in this kind of middle range of between 120 to 150%. And the fluctuations depend largely on the weather in any given week. But it's settling at round about that 125 mark now. And then my final slide was just to look at the GCC workforce and the significant change that's taken place in the way that people are working during the COVID crisis. The red bands in these graphs being the numbers within the workforce who are working remotely at home. So you can see the blue across the bottom is those that are still physically in work. That may be in Shire Hall, in a branch office, or in a job that takes people around the county, such as social work. But the biggest share of GCC staff during the period have been working remotely from their homes, as you can see I'm doing at the moment. And at the moment, we're encouraging people, wherever that's possible, to continue to do so. Because obviously, although we can begin to return people to Shire Hall, we need to make sure that we're making it safe for people to do that, and B, prioritising those people for whom it's most essential to work from the building. Of course, while we can begin to move people back into the building, we do need to maintain social distancing, and so that reduces quite dramatically the number of people we can have in the building at a given time, which is why we're not rushing to move people back in except where it's necessary in order to restart a service or for their own well-being. So those, I hope, give you a snapshot of the way that COVID has affected the council and its performance. If you'll give me a moment, I'll stop sharing the screen, and then I'm very happy to take any questions you've got about any of that, or as I say, my other reports that I've included in your pack.
Rob, first of all, thank you for your excellent overview. So we have questions.
Chair, we've got
Simon, if you could steer the questions out.
Yeah, we've got Councillor Rachel Smith. We've got Ian Doby, Leslie Williams, and Kate Haig.
So if you'd like to start off, I'll let you conduct it since I can't see everybody's hand.
Yeah, so Rachel first.
Okay, thank you. And thanks for the presentation, Rob. Just a real quick one to start, which was just the clarity I was seeking for the first slide, which is just, this is on children's social care referrals. Is this just new referrals, or does this also include the re-referrals? Because later on in some of the report data, it says about re-referrals. So I'm just curious about.
It will include both new referrals
Okay.
and re-referrals. Of course, the data you've got on re-referrals refers to the previous period, so that's for January, February, March. So you can't read the figures across one to the other, but we will shortly be getting out the data for Q1 that will give you a picture of how many of those have been re-referrals.
And my second question is really just about with both the referrals in children's services and in adult services. Obviously, there's quite a it's much lower than it has been, or in some places it's a lot lower, and there's a lot to make up in terms of the demand. Do we anticipate that we're going to see a big surge in the next kind of few months, and particularly as schools go back for children's services, but also as adult services start to kind of seek out those services more? Are we anticipating there will be a big surge in demand, and also do we think we have got the resources to meet any kind of surge?
I'll talk about children's social care first, because I think that's the easier to predict. I think it's accepted pretty much nationally that there's going to be a surge in demand, and that's likely to occur in September. And as I mentioned earlier, we've done some quite detailed modelling based on a model that Kent developed in terms of when that surge will hit different parts of the social care system, because obviously it is a sequential system, and so you'll see that demand affecting it at different points in time. I think the challenge for us is, given that that's likely to be a national phenomenon, and that we already know there's a national shortage of children's social workers, the question of how do you resource up to meet that demand is a really challenging one. I think, given what I've said about the fact that it'll hit different parts of the system at different times, part of this is about making sure that we're as flexible as we can be, so that we can direct resources within the system, even if we can't bring new resources in. But beyond that, there's limited action that we can take. Now, you'll know from previous reports that I've brought that our workforce is a much more stable one than it was this time last year. And so we're in a much better position to be able to deal with peaks in demand, but nevertheless, we aren't resourced up to deal with the sort of peak that might be coming as a result of this. So that will be a challenge later in the year that we'll need to respond to. With adult social care, I think it's much more difficult to predict because there are so many other factors at play, not least of all that I think the crisis will have affected people's attitude to what sort of long-term care they want for their elderly loved ones and for older people. So I'm not so sure that we will see a dramatic increase in demand there. I suspect less so, but we will only really know that for sure as the next couple of months move on and we begin to see how people respond to the lifting of lockdown.
Thank you.
Okay.
Thank you.
So now we've got a few more speakers. I'll just read them out, Chair, so people are aware. I'll be taking Councillor. Well, it wasn't Councillor Ian Doby. Ian, are you not wanting to speak now?
Sorry, it was about whether we can ask questions on the agenda item 5 written report at this point, or just on the verbal, the oral report, which has just been given by Rob. So I did have some question on the written report, but perhaps I should save those until later.
Yes, I think what we'll do is to go through what Rob's just done, and then we'll come back to the written report.
Okay,
we'll come
I'll
back
ask
to
my
you
question later.
Okay, so just to give you an update, so it'll be Councillor Leslie Williams next, then Councillor Kate Hay, Councillor Stephen Hurst, Brian Robinson, and Jeremy Hilton. Leslie.
Thank you. Is there any explanation, please, Rob, why the adult social care increased as dramatically as it did in June? That's the first one. And secondly, there was the number of news items this morning covering the increase in domestic abuse. So I was quite surprised to see that the figures for the county had if anything, sort of levelled off. The people who were reporting this morning on the radio were a charity called Refuge, so I don't know, they are a national charity. So I was just surprised it was as it is. So if you're unable to comment on that at the moment, then some sort of briefing after today would be great.
Of course. I think, so first of all, in terms of the adult social care, I'll be clear, I'm speculating because data is limited. But I suspect that the increase towards the end of May and the beginning of June is probably just the way that people responded to lockdown. That I think, during April, May, it felt very new. It changed the way that we were all living our lives, and probably somewhere around the 2-month mark, what we were thinking of as something that might be quite temporary, you begin to realise is here to stay. And I suspect at that point, people started to think longer term again about what the needs of their loved ones might be. And I suppose that's the point at which people stopped just trying to hunker down and live through it for a few months and begin to think about what support they need for the longer term. Although it is interesting that despite that increase in contacts at that point, the increase in referrals was much lower, which again, I suspect is that the kind of needs that people were becoming concerned about weren't necessarily the kind of needs that met social care thresholds, but were just about worrying about the impact on loved ones of being locked down for extended periods of time and needing less formal sorts of support. But as I've said, the processes that we've had in place to meet those non-social care needs have been pretty robust and pretty effective. In terms of the domestic abuse, you're right. I don't have an explanation for that, and so wouldn't attempt to offer one. But I suspect as time moves on, there'll be lots of questions like that nationally and locally we'll want to do some research into to understand what the impact was. In terms of our operational response, I know that we've gone to efforts to make sure that people could still refer into that domestic abuse service and to make sure that people were aware that it was there. But obviously the circumstances under which people will have been living will have made that more difficult for a lot of people.
Thanks, Rob.
Simon?
I think
Councillor Cahill.
Yeah, thank you. Thanks, Rob. I'm particularly interested in the operation of the hub and have some questions around that. I mean, obviously, a lot of people did contact the hub, but I mean, I'm certainly aware that for a lot of people, they didn't need to do that because there was a community offer, either from the district councils or community groups, and so I suppose the answer is we don't have those figures, but do we have a sense of or any feel for the greater community effort that actually protected our shielding cohort and others who couldn't access their normal services like help with shopping, things like that, and then going forward, I think most people coming out of isolation or will be by the end of this month. But for certain groups, i.e. if they have been contacted with a track and trace system, or if they are about to go into hospital for some treatment, they will have to isolate for 2 weeks, and that might be very suddenly. So is there going to be anything in place that people can use to support them if they are suddenly told, you know, you now have to stay at home for 2 weeks, and what we can do to support people in those positions, as you know, the wider effort is refocusing perhaps on other activities in the community. And then the final point I'd like to make, which was just about the engagement of counsellors in this system, of which there was really very little, and that was, I felt, a barrier. You know, I understand all the issues around GDPR, etc., but it was quite difficult to get information. So if you were dealing with a resident who had needs, to find out, you know, were they being supported in any way by anybody else? And whilst that meant that some people got perhaps more help, it also meant that some people didn't get the help they needed at the time, because you know, they couldn't access the shielding system, or they didn't know about the phone number, those kinds of issues. And it would have been really helpful also with dealing with volunteers. So if you had a resident who needed support and there was a volunteer nearby, we had no way of knowing that, or putting people in contact. So, you know, I mean, we all hope that we won't be in this position again, but I do think that some way of members having more access to and information about how that service works, because to be honest, I've no idea really. It was very difficult, and it was only really by going through districts that you could get any information at all. And I don't think that was the right thing to do, because actually, as councillors, we are connected into our communities and our groups, and we ought to be able to support them with that information.
Rob, are you able to answer?
Yes.
Make a comment?
Yeah, sorry, just took me a while to get off mute there. So I'll begin with the point about wider help, and you're absolutely right, Kate. One of the best things about the response is that so much went on under the radar, and we'll probably never know about. And while in some ways it would be nice to be able to quantify that, you know, as the statistician in the room, I always like to be able to put a number on something. Actually, I recognise that was the strength in our response. And certainly in discussions with other local authorities who responded in different ways, I think one of the things that made Gloucestershire stand out is that some of that help was organic. And for that reason, I've also got high hopes that it'll continue and we'll get a legacy from this well beyond the current emergency. So I think that's an absolutely positive thing. It does mean we haven't got a complete picture, but we have got a good sense. And certainly from the discussions that I'm involved in with district councils, from information we get back from people who really are on the front line of supporting some of those who've come through the Help Hub, the absolutely strong impression I get is that while the system may have had to mobilise quickly to respond, while we may have been designing it on our feet as we went, and as a consequence it wasn't always clear where one thing ended and something else begun, the effect of it was actually that people haven't fallen through the net. And I base that on the fact that, you know, we are now 3 months into this, and the contacts that now come through the Help Hub are largely either folk that are already on the radar coming back to let us know that there's been a change in their circumstances, or folk that have got a new need that's arisen. We are not finding people that have been languishing without the support they needed because they didn't know where to go. And I think that's really encouraging and really important, and as good a sign as we're going to get that the whole system mobilised and worked well. And we have tested that. So about halfway through the process, you'll know we've had some military planners assigned to the county to help with us. One of the things that we asked them to do was to test the robustness of our local response, which they did through interviews with people on the front line and our district council partners. And they came back saying that they felt assured that it was working. Your next question was about those that may need to shield if we had further lockdowns. I think one of the things that was messiest in those early weeks was around the data that we were getting from the centre about people who were shielding. But those lessons have been learnt now, and we do have really good information now on those who are shielding in the county, and that data will continue to be maintained even when the shielding programme ends. So we will carry on getting a feed from the NHS of individuals who are either remaining on the shielding list or who are newly on it as a result of some of the circumstances that you described, Kate. So that will mean that at the point at which, and obviously we hope we don't get to this point, but if we do have to institute any kind of local lockdown or further restrictions, we'll be very quickly able to interrogate that database to identify vulnerable people who will be affected and to make sure we contact them with the support that they need. So I'm hoping that clearly that will be on a much smaller scale to what we've just been through, and therefore it'll be much quicker and easier to mobilise that support, and I'm confident that we've got the process in place that will allow us to do that. On the point
sorry, Rob, come back. I wasn't talking about lockdowns, but about when we have individuals. So say tomorrow I was told I was going to have an operation in 2 weeks, I would have to start isolation from today. That would be it. Or say I've been in contact with someone with COVID, that would be it. I'd just be isolating. So it might be that people find themselves in circumstances where, you know, we haven't got a local lockdown, it's just their individual circumstances, which means that they unexpectedly perhaps have to isolate. And is there going to be something to support those people?
Yeah, so the same applies, that we would be able to cross-reference our databases to understand whether there were people who were particularly vulnerable and to make sure that we've got the support in place for those. And there are more schemes available to us than there were. So, for example, within the last month, DEFRA have negotiated a scheme whereby we can refer people for priority supermarket slots locally. And we set up the processes that will allow us to do that. And those that are managing the local outbreak management plan will have access to that scheme. So the minute they're aware of somebody that's being told not to leave the house, we can refer them onto that scheme and get them a priority supermarket slot. As I said, the fact that hopefully we'll be dealing with much smaller numbers and much more targeted communities will make this a much more manageable exercise than the one we've been through. On the question of engagement of councillors at the beginning of the process, I absolutely understand and recognise the frustration that a number of you had back in the dark ages at the beginning of April. Feels like a lifetime ago. I had a conversation with a number of you who had individual concerns about individuals in your community and are struggling to navigate the system to understand where you could find out information. So I'm well aware of some of the difficulties that existed at that point. All I would say is that I think we were all finding our way through that process at that time, and if it wasn't clear to you, it's probably that it wasn't clear to us either. It did take a good 4 to 6 weeks before the data started coming through to us in any way that was really comprehensive and that we were able to interrogate it fully. And as you said, there were issues around our ability to share that, some of which got ironed out, some of which didn't. I would say, though, that some of the reasons that you were being directed to district councils was that we did adopt very much that bottom-up response. So the county played a coordinating role and a referring role and kind of underwrote the activity to make sure that people didn't fall through the nets. But actually the coordination of the response was handled by the district councils at a much more local level. And obviously, because that was their focus and they were busy, there was sometimes a lag of a week or two before we got data back from those districts to let us know what they'd put in place in terms of help for individuals. So it would have meant that even if we had tried to give you a picture of who was offering help and who was getting support in your area, the likelihood is that would have been out of date. And that's why it was probably better to go through to the districts for that kind of information. But I do accept the wider point that one of the things we need to make sure is that we are absolutely keeping councillors informed about the local response and how they can contribute to it. And as I mentioned before, I know a number of you did a fabulous job within your communities, linking people up and making sure they were aware of the support that was available to them. And I suspect in lots of cases, providing that support yourselves.
Okay. So we've now got Councillor Ray Theodolu has joined the queue of speakers. So the next speaker is Councillor Stephen Hurst.
Thank you. Thank you, Simon. Thank you, Ray. Thank you, everybody. I was a bit surprised in the diagram regarding hospital discharges, the spike in May. But then looking at the diagrams for referrals to adult social services in June and July, which also climbed. I wonder whether there was a sequential activity there, people discharged from hospital and requesting support from adult social services. And also, second half of my question is, are we getting prepared for the winter flu season, which may well be coupled this year, a horrible thought, with the second spike of COVID-19, which will put even more pressure on our resources?
Thank you, Stephen. I'll keep my response high level because I suspect that there are others better placed within the council to respond to those questions in detail, and probably have already been doing so through the other scrutiny committees. In terms of the relationship between contacts and hospital discharges, my understanding of the data is that the hospital discharges wouldn't show up as a new contact because we have a social work team within the hospital supporting discharges, and so they wouldn't come through the front door in the same way. I suspect, as I said earlier, it's much more to do with the pattern of the way that we responded both as a system and as individual families to the changing nature of the lockdown. In answer to the second question, are we preparing for winter and a possible flu outbreak? Absolutely, yes, that work is beginning across the integrated care system. But if you want more detailed information about what that looks like and what that response is going to be, then you'd need to go to those that are working more directly on that, because I don't have that information today.
Okay, thank you. Thanks, Rob. Thank you.
Next speaker, Councillor Brian Robinson.
Yes, thank you. I'm interested in the 40% fall in referrals to children's services. I can understand why that's happened, because obviously with the schools closed, one of the key points of contact where referrals might arise. And I think as well, because children for a period weren't really allowed out, the other point where they do get sort of regular contact might be through the police. So our normal routes of contact were there. There's also, of course, the possibility that with parents being at home, that actually they were able to give a lot more support to their children, and so questions of neglect or whatever else may have been less. So that would be good if actually the outcomes for children were being referred were 40% less because children were being better supported. But the fear is actually it's the other way around it, that the children have the same problems, but we just don't know about them. And that leaves me a little bit uncomfortable, because we seem to be saying that nationally that come September there'll be a big surge in the referrals to children's services, which suggests that we believe that at the moment there are children in difficult circumstances that we don't know about, and we're going to actually sit back and wait until September, so that's another 6 weeks or so before we actually then pick up the pieces. That to me doesn't seem right. If we believe that the reason why the drop in referrals is because we just don't know about hidden problems, we should be seeking out those problems now and making sure those children are helped as soon as possible. If, on the other hand, we believe those children don't have as many problems because they've got a bigger support network from the community or family that are now more at hand, then obviously we can sit back a bit more comfortably thinking that their lives may be better. But I am concerned that our belief is that these children have problems, and we are going to sit back for 6 weeks further on top of the months that's already gone by before we wait schools to pick up and tell us what's going on. We ought to be putting in some sort of means or emergency, at least, to target the most problematic areas. Thanks.
Absolutely accept the point, Brian, and if I've characterised it that we are sitting back and waiting for it to come, then that's unfair of me, and that's a misrepresentation on my part of the reality. So certainly throughout the lockdown period, there was a concern that some of the usual touch points in children's lives were lost to us, and therefore we had less visibility of what children's needs would be. And so I know that efforts were redoubled to make sure that wherever we did have a concern, that was followed up on, and that we did what we could to identify children who were in need. And that's why I included in the graph set that chart showing the efforts that we went to make contact with those children who we did know about, bearing in mind that not every child's need is immediate or urgent. And actually the way the system works is that we have an early help system. We work with children in need before we get into the hard end of the safeguarding system. So lots of that work that took place during the early weeks was to contact those with whom we already had contact to make sure that needs weren't escalating or changing. Now, you're absolutely right as well to point out that we only know what we know, and there may be children out there that we are unaware of whose needs have developed or have grown during that time. There's been social media campaigns, there's been work done to reach out to those children to make them aware of how they can get in touch. And I already mentioned earlier on some of the mental well-being online mental well-being tools that we've invested in as part of this. And of course, that's another way of helping children and young people get in contact to let us know that they're struggling and that all may not be well. So absolutely, we're not sitting back waiting for a wave of demand to come in without doing anything, but we are reflecting the fact that it's been much more difficult to get that assurance that children are being kept safe, and therefore there is likely to be some impact of that going forwards. So it's a difficult message. I appreciate there's been no lack of effort to try and bridge that gap. Nevertheless, we do have to recognise we've been working in more challenging circumstances, and that will have made it much more difficult to keep contact with all children in the way that we otherwise would have done.
Thank you.
Councillor Jeremy Hill. Jeremy.
Good morning. I hope you can hear me all right. I noticed my Wi-Fi.
We can hear you. Yeah.
My Wi-Fi is playing up again. I just want to ask a couple of points on traffic volumes. I noticed you said that vehicle movements are now 85% of the normal, and cycling, well, the trend there is up and down. You know, it's 100% and it's 140%, but it looks like the trend is going back down again. Can you tell me how we are analysing the number of cycle movements? I mean, it must be more difficult than that of vehicles because there's a lower volume of people using that form of transport. So how accurate are those figures? Because you look at the cyclist graphic, it's all over the place.
Yeah, it's
another point after this one.
Okay. In both cases, it's sampled data, so clearly we don't have sensors on every road or every cycleway capturing data on traffic. But what we do know is the main arterial routes and the main cycling routes of the county, and the data is captured on those. So what you're looking at, yes, it is based on particular routes across the county, but there are data capture points in each district. I know that the cycling data includes a high proportion of dedicated cycleways rather than those that are shared with vehicular traffic. As I said in my presentation, the ups and downs, it's less obvious when you look at it with hindsight, but I've seen this data coming out on a weekly basis, and the downs occur when the weeks were wet, and the ups occur when the weeks were dry, and the real high ups occur when the weeks were very sunny, and the real low dips occur when it absolutely pours down for a week. So there's an absolutely direct relationship there between the weather. There are lots of people out there who, like me, are fair weather cyclists, I'm afraid to say.
I've got another point. So I assume then that we're going to see a drop in the number of cyclists anyway when we get to the winter months. The other one is looking at the traffic volumes. I'm just thinking about air pollution levels and whether we're actually collecting data that we can look at how air pollution levels have changed over the lockdown and as we come out of the lockdown. I'm thinking of the air quality management area in Priory Road, and I know that's had some sampling. That's in Gloucester, of course. And there's a drop to 55% at one time of the air pollution levels that were normal. So I just wonder whether we're going to, whether you, Rob, are going to put together a report about how the air pollution levels in Gloucestershire changed during the lockdown, and whether there's things that we can do to learn from that and to ensure that it doesn't rise to the same levels it previously was at. And assume possibly more home working will reduce the air pollution levels. People aren't travelling as much. I know from where I live around here, there's much more space in the on-street parking, so people aren't coming into the city centre the same way as they used to do. So I just wonder whether we're going to look at that in the future as well. So I think it's an important piece of data that we can consider, or another scrutiny committee can consider at a later point.
I think the key is in your final sentence, Jeremy. You're quite right. We do tend to have data for those areas where air pollution is a problem, rather than consistently across the county. And so compiling that data to give an easy county-wide picture as to what air quality is like is really difficult, because it does depend on where the districts are collecting that data and how they're collecting it. And it doesn't easily lend itself to aggregation up to a county level. For that reason, we've tended not to include it in corporate performance reporting, because you lose the nuance of that picture. I think, on the other hand, having a look at that within environment scrutiny, it feels that that's a more appropriate place to do justice to that issue and to get into the level of detail that it probably needs in order to understand it properly.
Yeah, I wasn't suggesting this committee, but it's something based on, we must be collecting the data across the county, and I think it would be useful that a scrutiny committee, particularly environment scrutiny, actually looks at this, looks at what the impact of the lockdown had on pollution levels in Gloucestershire, and how the pollution levels are being recorded and what the state they are at now as we come out of lockdown. It would be just useful information that we can help policy making, and we should be tackling some of these air quality management areas as well, and I don't think we are doing that.
And I think that point, Jeremy, is something which should be put down to the Environment Committee. So, it's an important point which you're making.
Yeah, well, that's what I'm just saying, Sean. We can put that point down and pass it on to the Environment Scrutiny Committee to consider.
Absolutely. Simon. Simon, you're muted.
Councillor Ray Theodolu.
Thank you, Chairman. Can you hear me?
Yes, we can hear you, Ray.
Yeah. Yes, there was one slide which showed the children's vulnerable children getting some sort of education, and I think the figure was 20%. Now, do I understand that correctly? That means that of the vulnerable children who could be getting an education, only 20% are. Is that correct?
I would make the distinction between attending school and getting an education, because I know a lot of schools, particularly secondary schools, but also some primaries, put a huge amount of effort in to support distance learning and deliver classes virtually using the same kind of tools we're using here. But you're right, the figure at the end of June for vulnerable children attending school was 28%.
28%, not 20%.
28% by the end of June. It was 20% during most of May.
But what does that 28? What does that cohort include? Does it include primary and secondary? So children from the age of
yes, it's across all
7 to 18, is it?
Yeah, all school age children.
What is it? Did you have the absolute numbers? How many pupils is that, in fact?
I don't have that to hand, but we could find that out.
I mean, it worries me that that is a shocking number, really, isn't it? That means that 70% of children are getting no formal education at all, by any means. And what are these children doing all day? I mean, it is really appalling, isn't it? Don't you think?
I've got one of them downstairs, hopefully not a vulnerable child, Ray, but I've got one downstairs, and it's certainly been challenging.
Yeah, I mean, these children are it's just when we see percentages, it hides something, doesn't it? If we were able to say, well, it's 1 million pupils, then we all fall over. If we say it's one pupil, it's just 10, and we don't get quite so worried. So it's quite important for these really shocking percentages to try and put a number around them. I don't know if that's possible or not, but presumably, if you've got the percentages come from somewhere. So
yes, somebody will have the number.
So somebody there, and I think we ought to make it more useful. It ought to be broken down by, if possible. Don't want to go through an awful lot of work to do it, but nevertheless, there ought to be some indication of what these age groups are and whether there's some evidence there, because there are some schools which have been going all the time. And we've had some places where parents are key workers. They've been going to school the whole time. I don't know.
I think it's an important
presumably
point.
They're not vulnerable children. I don't know. But,
Ray, I think it's an important point, but I think it's really one for the scrutiny committee, for the relevant scrutiny committee. So I think we might well be interested in what they decide.
Perhaps we could pass that on, please. Thank you.
And just for clarity, so the 28% is those who actually attended school. There will have been a much bigger number of children with whom the schools were in contact. So I know from my own experience, ours is a very small school, but went to great efforts to phone round parents on a regular basis, and the priority was given to those children who were known to be vulnerable. And I know that the vast majority of schools went to similar lengths and similar efforts to stay in touch with families, to make sure they got the support that they needed, and to make sure that children were getting an education during that period.
Thank you. Well, it's be passed on then, Sean, will it? You'll pass that on to the relevant scrutiny committee.
We'll take that as an action, Ray, in the same way that Jeremy raised the issue for environment scrutiny. We'll take this as an action for Brian's children and family scrutiny. Chair, if you're happy, we'll go to Ian, who had some questions on the report itself. You're muted, Sean, sorry.
Just before we do, has anybody else got any more questions on Rob on his presentation? Good. Sorry, Rob, I'd like to thank you for your excellent presentation and also for your answers. It's very welcome to see this coming back to us. It has been missed, and thank you very much. We'll now go on to the, as Simon's just said, to the paper itself, and I think it's Ian wanted to ask a question.
Yeah, thank you. Looking at agenda item 5, the paper report, which we all got as opposed to the presentation. Looking right at the top of the paper under adult social care and paragraph 2, I think, Rob, there's some information missing there because the second paragraph under adult social care doesn't really read correctly. I just wondered if you could fill us in with what is missing there.
Yeah, it's a very good question, Ian. I'll need to go back through earlier versions of the report and see what's got accidentally deleted there, because you're quite right, there is a paragraph missing, but I'm not sure what it should be saying, and I'm not sure my brain is going to be quick enough to work it out while we're sat here. Yeah, I'll get something out to you by email.
Okay, my other two questions refer to other points on your report. In paragraph 12 on addition. For addiction, I think the figures show that under the new contract, the current contract, we're doing rather better than under the previous one. I just wondered if you could clarify that. And finally, on paragraph 23 on home to school transport, I wonder if you could sort of update us on the latest performance figures until, of course, the end of term, when COVID crisis was in full spate. I think that there's a case for a little bit of updating of those figures in paragraph 23. But those are my two additional points, really. That's it. Thank you.
So on the home to school transport question, the figures that we've got in this run to the end of March, so not quite to the beginning of schools closing for lockdown, but very nearly to that point. Obviously, during lockdown, there's been very little home to school transport taking place.
Sorry, you're breaking up a bit for me.
Sorry. I was just saying that the data we've got runs to the end of March and therefore just before the lockdown period.
I'll switch my video off so I can hear you better, Rob.
Are other folk having problems hearing me?
No, it's okay, Rob. I think it's Ian. I'm getting a message against Ian. No bandwidth. Yeah, might be easier. Can still see you, Ian. Do you want to turn your video off? Can still see Ian's video at the moment.
Yeah, I switched my. Oh, sorry, I'm switching my video off.
That's better. That's better. Yeah. See if that's better.
I'll start again then, Ian. So all I was saying is that the data that you've got relates to the period up until the end of March, which of course was just before lockdown. The home to school transport, of course, will have been severely disrupted by lockdown and the fact the vast majority of children weren't going to school. But we'll be getting Q1 figures through for that shortly, and I'll be bringing those back to the committee in September. So I'll be able to give you a picture on that then. On the drugs and alcohol contract performance, you're quite right. At the beginning of the contract did see a dip in performance as the new contract mobilised, but it has now improved significantly. And as the report says, the current performance is much better than that historic level, and compares well to comparator authorities as well.
Thank you. Thank you.
So, Chair, just made a comment on Rob's report. Any learning points spike? Leslie, did you want to speak?
Thanks, Simon. Yes, Rob, it just struck me that, and thank you, because it is useful, but it's more factual than anything, and so it doesn't necessarily look at what went well and what perhaps didn't go quite so well. So really, yeah, the learning points for next time. I mean, were there any? I suspect things that really were, worked better than expected, and other things that you think, oh, we shouldn't have done that, change it quickly. Reality, please.
I think the truth is, while we're talking about this in the past tense, it is only just in the past tense, if at all in the past tense. And so the opportunities to learn lessons and reflect have been few and far between so far. But we are starting to get to that point where we are capturing learning more formally. And in fact, as a GCC leadership team, we've got a session in a couple of weeks' time to begin to do that. And to capture what the lessons are, what things we would do differently. As we haven't been through that process yet, I can't really speak for anybody else. From my point of view, in the parts that I've been responsible for, which have largely been around the data management and the management of the shielding cohort and support for communities. I talked about some of the lessons earlier on. I think had we known at the outset how things would pan out and the extent of the data that we would need to be managing, we would have probably taken slightly longer to set it up, to set some of the databases up initially, and may have configured them differently, but we couldn't have known what sort of questions we were going to need to interrogate the data at that point. And actually, the way that we did set up our systems have given us quite a degree of flexibility on how we can interrogate the data. Without getting too technical, what do I mean by that? Well, I know of a lot of local authorities that 6-7 weeks in were still relying on Excel spreadsheets for capturing data, and then really struggled as the data requirements got bigger. So there was talk round about the middle of May about MHCLG introducing a data collection to demonstrate how local authorities were responding to communities. And there was uproar within local government because most authorities didn't have the systems in place to be able to capture and report that data. We would have actually found it quite easy. We kept quiet about that because we weren't keen to have another data burden placed upon us at the time. But actually, we would have found it quite easy, and we're already reporting some of that data locally. So our data systems have served us well, but with hindsight, there's things we would have done differently. And I think on the community resilience side, as I said earlier, I think the real strength has been in the fact that it has been so organic and so bottom up, and the fact that we've tried to make sure that there are sufficient fail-safes in the system that people didn't fall through the net, without trying too hard to control the system as a whole. And I think that's sort of some really good stead. I think some of the things we could have got better earlier on are probably around communications, where I think it was quite confusing for folk who needed support, how they could access it. Not necessarily from a GCC point of view, but across the system as a whole. I think we were all struggling to get information out in different formats and in slightly different mediums. And as a result, some of that cut across each other. And I mean, that's not a criticism of communications colleagues. I think they did an excellent job, but some of the stuff we were trying to share was quite complicated messages, and we were all trying to share it at the same time. And I think at this stage of the journey, we've established some clearer processes and would be able to use those much more consistently going forwards.
Thanks, Rob. And are you going to ask the public what they thought of how it all worked? Public perception is all.
Absolutely. I mean, all I can say is that through the work we have been doing with the Community Resilience Cell, we have been getting feedback from members of the public, and a lot of that has fed back into the Community Resilience Cell. Essentially, that's only one aspect of the response that we've had. The interesting thing was it wasn't very long into the process before people started moaning at us. They were being contacted too many times to be asked if they needed help, which I took as an encouraging sign, but we also responded to and called off some of the calling round that we were doing. So I think we have a reasonably good sense of how well the system worked for people. But as we get to a more calm stage now, you're right, it would be good to formally capture some of that and make sure that we have heard and learned all the lessons we need to.
Okay. So Leslie, could you lower your hand? Is that all right? Stephen as well, Stephen Hurst and Ray Theodolu. If you could lower your hand. So Chair, that brings us to the end of anybody wanting to speak, as far as I can see.
Good. So are we now finished on that agenda item, everybody?
Yeah. So your next item is the strategic performance, the finance monitoring report. Absolutely. Presented by Paul Blacker, which includes the extra supplement that was produced based on the Cabinet report yesterday. Yes, but can we actually split that into two? I think we want to talk about the paper which went round first, which of course it is historical on the whole, and then we will look at the other paper, which is the more interesting one in many respects, secondly. So, Paul, welcome. And we'll look forward to your presentation.
Okay, yeah, thank you, Chair. Okay, I'll take the first report, which was the outturn for 1920. I'll take it that everyone's read it, and I haven't received any questions, so we'll just go quickly through the highlights and then can answer any questions afterwards. We did end the financial year with a slight underspend of 326,000. Which in a 470 million budget is, a very small percentage. That 326,000 will go into general reserve, so that puts up the general reserve slightly. So that's a good overall position, but as councillors will notice, it does mask some large variances. Children and families at the end of the last financial year overspent by almost £14 million, caused by two major issues. 8.8 million of external placement costs. That's caused by both volume, but actually the biggest driver is unit cost. Unit cost is going up considerably. That's just because of how the market is, and also because of the complexity of some of the cases. It's kind of a national position, and kind of we reflect that. And the other major issue is kind of 2.7 million on safeguarding staff. Again, that's to do with kind of sheer volume of cases coming through and the complexity of those cases. Fortunately, we were able to kind of offset with that, almost 9 million of corporate central underspends. There was kind of 3.3 million, which was earned on additional interest income. And that's to do with kind of, we set some kind of long-term, we invested our money in some long-term investments and got quite good returns on those. Since the budget was set, we received 2.7 million of additional grant funding, and that was declared at the end of February after the council had set the budget. So that was additional income that came in. We also got the confirmation of 1.2 million business rate money that came from the pool from previous financial year. So that was a kind of one-off gain. And we do build into it. We have a contingency within corporate of about 1.4 million, which is to do with any unachieved savings. So we could declare that. So that was good that we have those corporate underspends, but we also had to do a review of kind of reserves, and we contributed 4.7 million from reserves. So we could actually, these were kind of previously earmarked reserves. Each year we do a review of those earmarked reserves to see if any of the commitments and liabilities are no longer in existence. And there was some one-off reserve of 4.7 million that we could contribute. So basically the problem or the issue continues to be children and families, where we had the 14 million overspend, but we did find some compensating savings in last financial year to compensate that. And we ended the financial year on a slight underspend. So I guess that's kind of the highlights of that report. So I'll kind of stop there and can answer any questions.
Is there anybody who wants to ask any questions on the report, please?
No. Rachel, Councillor Rachel.
Yeah, just.
Want to speak, Rachel?
I don't know. Sorry. Can you hear me?
We can hear you. Go on. Yeah, we can hear you.
And we can see you.
Great. Okay. So just on the you mentioned the business rate in just what you said, and I'm just trying to work out: are we likely to see? How much are we relying on, or how much are we expecting in from business rates this year?
Sorry, Rachel. We're looking at last year first, and then we're coming on to next year as a separate item because it's a separate paper.
Okay, I'll ask that in a few moments then.
Did you have any other questions?
No, it was really just about about that.
Okay. Has anyone else got any questions on the paper which Paul's just presented?
There's no one else with a hand up.
In that case, if you're all happy, we'll move on to the additional paper, which is much more about the current year and the outcome which we're looking for. Paul?
Okay, yeah, thank you, Chair. So this looks at, this is the first outturn forecast for the current financial year 2021. Overall, we're forecasting, when this report was written, a 15.7 million overspend. I think it's probably worth splitting that into two, as the report does, which is kind of the COVID-related spend and the non-COVID stuff. So we start with the non-COVID. If we look at that, we're forecasting overall a 4.1 million overspend. Again, that replicates the issues last year. We're forecasting a 9.6 million overspend on children and families, again driven by external placements and kind of staffing costs. But again, we have found some underspends within the corporate budgets of about 5 million, and then there's a few other minor changes. But the net position is a 4.1 million overspend. This excludes COVID of children and families. So that continues to be the big financial risk that the council faces, is children and families and the continuing demand, increasing complexity of the cases they're having to deal with. So that deals with the non-COVID stuff. So if we move to the cost and the lost income associated with our response to the pandemic. So we were forecasting an 11.6 million overspend on the COVID things, because we have got a grant, and we had a grant of just over 27 million at the time of publishing the report. So we had an 11.6 million overspend on COVID. Since then, we have got, the government has announced the third tranche of finances for the council. So we got 3.7 million from that, was Gloucestershire County Council's share. And in addition, the government have announced a lost income grant, which is actually based on any income that was lost as a direct result of the pandemic. We won't know what that is until the end of the financial year, because we won't know what income we've actually lost. But we're forecasting that's going to be about 3.5 million. So if we take those two figures off the 11.6 million in the report, we get to about a 4.5 million overspend to do with COVID. The government has indicated that there might be additional grant funding available going forward. One of the big pressures is home to school transport, and maybe the need for social distancing, or maybe not the need for social distancing from September. So there's guidance coming out from the Department of Education about exactly what that means. At the moment, we've got a 2 million forecast in for the cost of social distancing, but guidance coming out over the last week seems to indicate that we probably won't have to implement social distancing in the same way that we initially envisaged. So that might put that pressure down. So I think on the COVID issues, I'm confident that we would probably get some additional funding. Some of those forecasts, as we get more clarity from the government, especially about what happens post-September, might mean that we can reduce some of those forecasts. And if we can't reduce those forecasts, we just have to manage our expenditure going forward to ensure that we do stay within that, the funding that we get for the COVID-related issues. The non-COVID related issues, as I said, are driven by children and families, and that is an area that kind of the officers and cabinet are concentrating on to try and get that budget back with it, get the expend back within budget. So that's my update for the current financial year.
Thank you, Paul. Just before we go ahead, can you just relate that to our reserve position, our general reserve?
So our general reserve is about, we've got 18.5 million in general reserves.
Thank you. Rachel, you had a question.
Yeah, thank you. Two questions. So one is around business rate retention. Do we have any scheme like that in place for this year? I haven't seen anything specific to it, but I may have missed it. And my second question is, so we were 14 million, was it, overspent in children and families last year? We're already looking at a 9.5 million overspend in children and families this year. I think I saw on external placements. Why is that still an overspend? Why aren't we just accepting that it's really, it needs the money? I don't understand why it's not just budgeted for. Why is it an overspend?
Okay, I'll start with the children and families because you broke up with your first question. So I'll ask you in a minute to just to repeat the first question, but I'll go through this children and families. So obviously we set the budget based on the best information we have available, based on forecast and the number of placements and the average cost of placements. And in last financial year, at the start of the financial year, from memory, we added about an extra 14 million into children and families. So the budget increased in children and families. About 12 million. We had 12 million to children and families budgets. And that was based on the best information we had available about the forecast, about number of placements we thought we were going to have and the average cost. But the overspend is over and above that position that was forecast in February when we set the budget. So we increased the budget, but we are overspending on that increased budget.
Okay, so we're overspending on top of the additional money that's been put into the budget for that. And in terms of the forecasting, what we're saying, that's the best information we had at the time, and we were aware of, presumably a lot of this is to do with, high needs, complex cases. Are we not aware of those complex cases? Like, what is it, because individually these contracts have exploded in price, or is it because suddenly there's a lot more young people who are in need of really significant specialist care?
Yeah. Okay. So we added. Just having a quick look at the papers that went into February. Our estimate was that we added about 7 million for external placements onto the external placements budget when we set the budget, and that was considered based on the forecasting and looked at the trajectory of numbers of cases, numbers of children, and complexity of cases. That was the best estimate at the time. So I think what's happened is, as I said in my presentation, it's the unit cost which has been the big driver in that. There's more complexity of cases, so the cases are slightly higher than they have been previously, and Rob's kind of figures back that up. But the main driver is actually the unit cost, which is driven by both the market scarcity of places and also the complexity of the cases that we're having to deal with. So we set the budget based on the best information we have at the time, based on trajectories and number of cases. But what's actually happened in the first few months of the financial year, and looking at patterns, we think it's going to exceed that. Built within that is what we mentioned in Rob's presentation about an expected peak in September, where we think we're going to get more activity because our main referral place is coming from schools. Schools are being closed. So we think there might be a peak within in September, and a contingency has been built in for that. We don't know what that is. There's been various modelling, but no one really knows until the schools come back in September and we start to get those referrals in September and October. So basically, numbers have just increased more than we thought. We're expecting that peak, and unit costs have increased.
Okay, thank you. I mean, it just seems. Sorry, may I?
I'm just going to suggest that if we're going into more detail, I think it's one for the relevant scrutiny committee.
Well, I was about to say.
But please do ask your further questions.
Yeah, sorry. So, who is the current chair of Children and Families? Is it Brian?
It's not me. It's Andrew. I'm now chair of Health.
Oh. Oh, that's sorry. So it's Andrew Miller. He's not here.
It's actually Andrew.
Okay. I'm just kind of curious about what level of work, because it just feels like it's a big mess, just from a financial point of view, and also from the kind of monitoring stuff in general, about we're not meeting our targets, and that's real lives. So I just would like some reassurance, but unfortunately the scrutiny chair is here on that area, because it's still in such a mess. I'm just.
Rachel is the vice chair of that committee is actually here, and that's Councillor Leslie Williams. So I'm sure she's listening.
I think she's gone, hasn't she? I think Leslie's gone.
She dropped out of the meeting. We will include it as an action to refer it across to the committee. All right.
Yes. Yeah.
You had another question about business retention scheme, didn't you? For Paul?
Yeah. Just for Paul. Yeah. So just on what business rates are we expecting? How much are we relying on that? And again, in terms of how much would that be impacted by businesses closing or even temporarily closing during COVID? Is there any comment on that, please?
Okay, obviously business rates quite complex, and they're collected by the district councils, and we have a pooling arrangement. So the easiest thing to say is that in the current financial year, we built into the budget that we were going to get just over 2 million as a surplus to the collection fund. So we will get that. The impact on non-collection of business rates, etc., won't actually be hit until next financial year, because we got the pooling arrangement. And so therefore, what we're anticipating is, I think the impact is going to probably be about 3 million. The current estimate is about 3 million less than we expect in next financial year, because we built in the fact that we were going to get a 3 million surplus, as we normally do in the collection fund. I think realistically, we're not going to get that surplus going forward. So that's the kind of very high level estimate. But obviously needs to be a lot of work done, because no one's sure about the depth of the potential recession and how long that's going to last, what impact it's going to have on businesses, what impact it's going to have on individual council taxpayers as well. So there's a lot of work going on locally and nationally about that. So so high level is, we won't get a surplus. So I think that the minimum impact is going to probably be about 3 million.
Okay,
thank you, Paul. Have we any more questions, Rachel?
I'm done. Thank you very much. Really helpful.
Has anybody else got any questions? Simon, I can't see it,
I want to come in, Sean.
Councillor Jeremy Hill.
I could see Simon speaking my name. I was lip reading him, but he did
you can hear me now, can't you? You can hear me.
Yeah, can I just back at what concerns that Rachel was saying about children's services? And I've mentioned this before, but we had a budget around 75 million just about 3 or 4 years ago, and it's almost every year there's an overspend of £10 million, and every year the cabinet member promises that he's got the budget in right. And we know that last year there was a massive overspend of 14 million, and now we're projecting another 10 million overspend in this financial year. And we're talking, it's external placements. Well, why are we still doing so many external placements? There's also issues about agency staff, social workers and that lot, but not full-time staff. That hasn't been resolved. I think there does need to be a comprehensive look at children's services, and we need to look at how it's failed in maintaining its budget over the last, say, 5 years, and what's happened, and what the overspends have been, and what the real reasons are for it, and exactly how many children we're looking at, and the complicate. So there's a proper statistical information that can be interrogated properly by an appropriate scrutiny committee. And Chair, I think that should be done by the Children's Services Scrutiny Committee and by this committee, because it's about budgetary matters. because I want to know why we are really having this problem. Because we're promised every February the budget's accurate. This is what it will be, and every year we overspend, and it's just not on. I mean, there's something going wrong here in the way that we're managing the service. If we're paying too much for services that people provide us, then why haven't we come round and looked at it and we talk about, it's what the market's demanding? I'd like to know exactly what impact it's having on other councils as well. So we need to take some action, and the cabinet member needs to take some action. Also, the chair of the Children's Services Committee needs to take some action to thoroughly investigate this, because we can't keep blowing the budget every year, can we? We've got to stick within it.
I think you're making 2 points there, Jeremy. It seems to me that it, as you said, basically one for the relevant scrutiny committee. But I do think that, given what you're saying, I hope they'll be able to produce an overview which could come back to this committee so that we could all be informed. But I would think it would come up from them rather than for us to do it additional work. I don't know if anybody else wants to make a comment on that. Simon, you might want to make a comment.
So Ray is trying to, and Councillor Brian. So Councillor Ray Fiordolo and Councillor Brian Robinson are both indicating to speak.
I can't hear you, Simon.
Can you hear me now? Sure. Can you hear me now? I'm speaking.
Yes, I can hear you now.
You can hear me, right? Okay, so it's Councillor Brian Robinson next.
Thank you. I mean, listening to the comments, I think it needs to be taken on board as a former chair of that committee, that the committee has been looking at this, obviously quite extensively, as you would expect. The information coming through in the most recent meeting does indicate that progress is being made, but really not at the pace that Ofsted or ourselves would like. So I think, there's no reason why this committee shouldn't send a message back to that one to ask for further information, because you're right, the end result in terms of budget is a factor which impacts on the whole council. So it's not just of interest to the Children and Family Scrutiny Committee. So I think that's reasonable, but I do think that we ought to note that the committee is onto that case. The issues are complex, and I think it's perfectly reasonable for anybody in this committee who wants to. They can actually follow those committees, because they are on live like this one is. So I think might be helpful that members of this committee join in and watch the proceeds of other committees, because we don't want to duplicate it, but at the same time I think we do need to recognise that the challenges that the Children's and Families area is facing are large enough to impact on the whole council's service delivery, not just in that area.
So then we've got Ray.
Thank you, Chairman. Yes, I mean, I actually share Jeremy's alarm at this. I mean, we basically in this council are getting down to the level where we have two statutory services, the children and the adults, which are consuming more and more of the council's resources. And the children's is, I mean, it's these are statutory, so we've got to provide these services. But the children's £100,000, I think that's because we have to send them out of county. And from what one hears, the services that are being provided, it is a shrinking market, and therefore we can only expect our costs to go up as long as we've got this demand from our children. And I think it's rather alarming. The other thing I'd say is, in respect of this report, is the adult side. Now, we've got a position where the government is under considerable pressure now, following the disasters that have followed in care homes with the COVID, with NHS releasing patients into the care home sector, which is basically a private enterprise. They've been so the public sector has been releasing patients into the private sector, and where these private sector people have been infected. This just cannot go on. There has to be a more coherent policy between the NHS and the care homes, which themselves are in shrinking numbers. We know that. There's a shrinking number of homes that who are taking people. So that sector, I believe, could be another disaster waiting to happen if the government review of the whole business turns out to be thrusting more and more on the local authorities, and we're just going to run out of money if we have to deal with the adults in the same way as we are dealing with children. And I think the children department ran out of reserves some while ago. Paul can probably tell us that, but I think the adults probably still do have some reserves in there to draw upon. But the two combined is very alarming. You could just foresee the time when 90% of our resources are taken up with these two areas, and there'll be nothing left for other parts of the county. So I think we have to be very aware. I don't know what Paul Blacker can say about that, but the reality is that we are in a very bad place, and we're not the only council. It's no consolation to know that others share our anguish about this. And I can only express my personal alarm. Jeremy's made a suggestion, which I think is a good one, that we should perhaps together with the other scrutiny committee call upon some more detailed analysis of the children's. But I'm also very worried about what's happening in the adults. Thank you, Chairman.
So, thank you, Ray. I'm just going to ask Lyndon, who I think is still with us.
Yes.
Comment. Lyndon?
Thank you, Chairman. Well, I guess our comment is, yes, we of course are concerned about the increasing overspend that we see on children's. And I know that Richard Boyles is obviously very much on top of this. I think what I would say is that there are some in place. For instance, Trevone House, which I don't think has been mentioned yet. So when Trevone House comes into operation, we would hope that would generate in itself a reduction in some of our costs. And once we see how that operates, we'll hope that might give us a model for maybe a Trevone House 2. Okay, we could hopefully again, come up with a further batch of reduced costs. But I think when you do look at some of the individual expenditures that are going on, I think it is quite clear. I know that Children's will have looked at this before. That it's the placements that have gone up significantly. Now we're talking about figures, an increase year on year, sometimes of 30 to 40%. And that is, as I understand it, one of the biggest components of the increase we are seeing. Now, I think adults, we have more of a plan in place, but I think with children's, there has really been a case that we obviously need to address the concerns of Ofsted. That is being done. But I think as we go into the future, yes, we will need to look at alternative methods of delivery, and we are doing that. And Trevone House is that case in point. So that would be my comment specifically on children's, Chair.
Thank you. I'm just wondering, I think what would be useful for us is particularly picking up Ray's points, that we've got some long-term trends here which go back quite a long time, and we can see them going forward. And in fact, as Ray said, the two items, children's services and adult services, are consuming more and more of our overall budget as a percentage. And I think it would be quite useful that maybe in time for our next meeting, be part presumably of the budget setting process anyhow, to have a sort of overview of what is happening, also looking maybe a little bit more into the future.
Chair, Ray wanted to make a point, and Jeremy as well. So Ray first.
Thank you, Chairman. Lyndon, I take what your point, but we haven't got a good record with these houses, this residential care, which Trevose which I think will be one of the things which you're talking about. And don't forget, we closed Colne House, and when we did that, we were told the model is broken. It's not the right model, and so it has to go. Now, I'm not saying that Colne House was most efficiently run organisation, but nevertheless, we took the view that we were going to close it because the model was broken, and now we're resurrecting the model on perhaps a smaller scale. But we haven't got this right in the past, and I just worry that we're not going to get it right in the future. And the costs, I mean, £100,000 per child. And I believe that's going out of county into residential. I might be wrong about the resident, but I think that's correct. And it can only go up, can't it? If we're talking about restricted demand, and if you're talking about having further residential accommodation here, that's not going to be immediate. You're going to have within the county. You're going to have to. That takes time. How long has it taken to get this one building under? Is it Trevose or Trevone? I can never remember. Whatever the name of the thing, it's not open yet, and it's been going on for a year or so. I know it's got to be. The buildings have to be adapted and all that, but these things do not happen instantaneously. So I don't think we can look forward to any sort of serious reduction in the numbers of our children, in the costs of this service being reduced in near term. And I would have every expectation for it to be rising. It's not a very comforting position to be in.
I think Lyndon wanted to come back on that, but Jeremy's probably going to raise an issue around Jeremy.
Well, I think the sort of savings that were suggested from Trevone was about a couple of £1 million. So we're going to need half a dozen Trevones in order to balance every year, in order to stop the council overspending as such. And I also think that the issue is that Trevone is supposed to be there to assist teenagers as they start to live independently in our care. So I'm not sure whether it's the same cohort that is causing the additional costs that are being placed out of county. I'm sure these are new children that have come into the care of the county that are being placed that's costing us this massive amount of money. So, it really it's not just this year, it's happened before, the year before, and the year before, from memory, and probably the year before that, is that there's a problem in that we're not maintaining it, and we're then keep being told it's because of external costs. So we ought to be able to control those external costs by doing things internally. And I think there needs to be a thorough review. Otherwise, the budget every year will overspend. I mean, we've agreed, I can remember speaking at budget setting, saying I was happy to support an extra 10, 12 million pounds this year to make sure that children's services was properly funded. And they did it again the year after. But it's happening every time you do it. You give the support. I mean, we all want to make sure that our children's services provide the first-class care for the children that are in our care. But it doesn't mean that first-class care has to cost a fortune being provided out of county, for example. So I think Lyndon, Richard Boyles, and the chair of the appropriate scrutiny committee have got to thoroughly investigate this over the next few months so that we make sure that we don't end up with another year like this and another year like this. Otherwise, we will run out of money. Our reserves will disappear, and then we'll have real problems. And it'll all be down because we're paying too much for a service that the market doesn't want any longer. So what you do is you provide those services within house if the market's too expensive. You stop commissioning them out of county. I would have thought was a sensible solution.
Jeremy, I'm going to ask Lyndon if you'd like to make a response. Obviously, we will be requiring, I think, a report back to us. But Lyndon, do you want to make a comment?
Yeah, well, to absolutely say that I think Cabinet as an administration completely share this frustration about the increase in those placement costs. But what I would say, Jeremy, is what you've just answered the question really as to why, for instance, we are investing in Trevone House, because that is bringing costs more under our own direct control. And my own view is that a county, we're a big enough county to actually try as far as we're able to deal with our own problems. So I think that's something that we also should do. What I would say is there's a lot of data around, and I'm sure that Rob Ailiff will be able to ensure that your members of the committee are given some of this, which benchmark us. Exactly the same issue is being faced by virtually every other county council out there. So we are not alone. It's not as though it's just our model that is bust. It's the demands of the system, and it's that increase in capacity that is not there, but the demand is increasing, the capacity isn't. That's what we need to try and address. But I'm, so two messages from me. We're absolutely aware of this and equally frustrated. Secondly, I think there's a lot of data that we do need to share with your members to make sure that you have an understanding of what's going on, not just in Gloucestershire, what the trends are, what they are elsewhere, because they're exactly the same. Thank you, Chairman.
Thank you. Sorry, wait a minute. Thank you very much, Lyndon. I think on that subject, we'll have a report coming back to us. Sorry, Paul.
Yeah, I was just going to make a couple of points, just to clarify. And with Simon, I think we did have Chris Spencer, didn't we, that came to a previous committee from memory?
Yes, that's right.
Yeah, so maybe, maybe a suggestion for me is that we, repeat that again. And he sort of, did say what progress he had made and what progress he had planned. And perhaps, I don't think we want to override what the children's scrutiny does, but, I think it's a legitimate concern from people that maybe we can invite him and the cabinet member again. And just one point on adults. I think the issue is those councillors who have been here, a while will remember that probably 4 or 5 years ago, we had traditionally overspent on adults, and that was a national problem. And the government has recognised that, and we've been raising a 2% levy each year for the past 4 years. And that has resulted in the fact that the adults hasn't overspent. But obviously that's only a temporary solution. There is a longer term solution that, they're looking to review now. So overall, adults over the last 3 to 4 years have been okay, but children are the real issue.
I've seen you, Ray.
Yeah, sorry.
I would quite like to bring this, thank you very much, Paul, for that comment. I'd quite like to bring this item to a close. I think we're beginning to go round in circles slightly on it. I think we all realise that the report needs to come back, and it needs to be shared. It needs to have, and then obviously Lyndon supports that. So, Ray, do you have a separate point to make, or do you want to come back to what we've just been discussing? We can't hear you.
You're muted, Ray. Hang on.
Sorry about that. We have to look back. And understand that we did try, that we did actually run a number of facilities for young people within the county. They were residential, and we closed them all. And now we're talking about, Sean, you know that as well as I do.
No, I know, of course I know it.
And we closed them all because the model was, we couldn't run them effectively. That was the problem. Now, what is when we're talking about bringing things back again into the county, constructing our own capacity, we have to remember that we failed to deliver with our own capacity, and we took the decision. We said the models failed. So, Lyndon, I'd ask you to be very careful about asking questions of the children's group about their capacity to run homes in a safe way, up to modern standards of safety too, because that was one of the criticisms that was made of us before. Sorry, Chairman, I won't rant on anymore.
Okay, thank you. Has anybody else got any points to make on that?
Chair, Councillor Brian Robertson, you've still got your hand up. You've just got to lower it.
Will do.
Yeah, okay. So, Chair, I can see, I think there are 2 points coming out of this then, to refer this across to the Children and Family Scrutiny Committee in terms of the concerns that have been raised today, and then a report coming back to this committee with the cabinet member and director coming along.
Yes, but I think there's a further one too, actually, Simon, which is the one which Lyndon picked up, which is the overall impact on our finances, not just specifically on the children's services and things. So we need to have a look at the overall view and the trends going forward, backwards and forwards. Is everybody happy about that?
Okay.
Okay, anybody got any more questions on this item? I think it's the last item on the agenda.
No, we've got one other item. There's no one else.
Of course we have.
Indicating, no one else. Oh, hang on, Stephen Hurst. Stephen.
Thank you.
Yeah.
Thank you, Chair. Thank you, Sean. Looking at the breakdown of costs for the whole council, adult social care have an overspend of, what is it, 20,567,000, which, according to the chart, is entirely down to COVID-19. Without that, I doubt whether adult social care will be overspent to any large degree. Is that not correct, Paul?
Yeah, that's correct. If you look at the table, it shows that the COVID forecast is 20.5 and the forecast excluding COVID is 0.
Thank you.
And there is an underlying overspend of 1.8 million. As was pointed out earlier in the discussion, adults have got a reserve and that's being funded from the kind of reserve, because that kind of budget, there will be some fluctuations between years.
There's 4.6 million reserve, isn't there?
Yeah.
Okay.
So that brings us to a close, Chair. There's no one else indicating to speak, and I think we've clarified on the actions, haven't we?
Good. Shall we move on to the next? I think the last item on the agenda now.
So, Chair, so just a quick time check for people. It's getting close to 12:30. So this is a relatively short item. Equality and diversity member champions, and this comes back to the committee after it was raised back in November of last year, when the leader came to one of your meetings. It was agreed that a proposal will be drawn up for the establishment of an equality and diversity member champion that could meet periodically with the leader of the council. And the proposal that was put forward was that each political group would nominate a champion, and these would meet with the leader of the council twice a year. Now, I know Councillor Leslie Williams has left the meeting, but she's already put in the chat that their champion would be Councillor Kate Haig. So in the report that's before you, there's also a very brief role description. So shall I just read that so you've got it, so members are aware of it?
What are you going to ask? I mean, I've actually read it. Has everybody read it?
Yes.
And we've got the relevant director, Mandy Quayle, with us as well. So I'm not sure whether there's anything you want to add, Mandy, at this stage.
Oh, I don't think so. It was just in case there were questions about the proposal.
Yeah. I've actually discussed it very briefly again with the leader. He's very happy with it. I suggest we go forward with it, so long as everybody's happy with that.
So Rachel,
we'll be now seeking nominations from each party.
We can do that afterwards, Chair.
Afterwards.
Yeah, we'll do that afterwards. We'll approach. I think Rachel wanted to raise a point. Councillor Rachel Smith.
Yeah, I mean, this looks good. I just have a question for Mandy about in section 2 of it, the background, where it talks about the due regards template. Can I just ask, is that the current one that we see attached to decisions currently, or is there something new coming?
There is something new coming. We're having a look at the whole approach around due regard statements and whether they really get to the guts of the issue, if you like, in terms of how we're protecting those with protected characteristics and the actual impact. So we are having a look at the whole process.
Great. Okay. Yeah, that was the question, because I think that this is good, and I'm not sure if you from our group will be doing this, but I think it does. It really does need to have a kind of a what's changed sense to it. If we're going to, it's not about ticking a box or it's. I really want to see that kind of what's changed as a result of this process.
Any other comments?
I don't think there are. Councillor Stephen, has you still got your hand up from before?
Right.
Can we all?
So there's no other comments.
Good. So we're all happy with the suggestion? Agreed, Paul.
So we'll pursue that after the meeting and get nominations from each political group.
Good. That's excellent. I think it is an important it's an important step to take. I think that brings us to the end, Simon.
That's the end of the agenda.
Yeah. Okay. Thank you all very much. Thank IT for getting the act together at the end of the day. These things happen. But that's excellent. Thank you.
So from our side of it, Chair, an apology, but we did manage.
I wouldn't apologise.
Well done to everyone actually for managing to log in again. It was very, very impressive on behalf of members. Right. Thanks very much. All right.
Thank you.
Bye.
Nice to see you all. Bye bye. Thank you.
So from our side of it, Chair, an apology, but we did.
I wouldn't apologise.
Well done to everyone actually for managing to log in again. It was very, very impressive on behalf of members. Right. Thanks very much. All right.
Thank you.
Bye.
Nice to see you all. Bye bye. Thank you. So from our side.